Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. I want to break some things down today for anybody who's ever seen a specialist for any type of back problem. Do you know that the #1 cause of lower back surgery is not how bad the image looks, how bad things hurt, or any of that? Instead, it's actually zip code. So hear that again. Real quick, actually, before I do this, it's zip code. My name is Dr. Charlie Johnson. I'm a physical therapist, and I help people get back to normal without images, without pills, injections, or surgery. Call 484-552-3767 for natural relief. So you heard me correctly. The biggest predictor of whether or not people with back problems end up getting spinal surgery is not how bad they feel, not how bad the MRI looks or what shows up on it. Instead, it's actually zip code. And what I mean by that is the more surgeons that live in the area, the more surgeons and sort of surgical centers there are popping up around the area. By the way, there's a lot around here. The more likely one is to have spine surgery. And this is based off a very large study. It looked at lots of people, and in my personal experience, I've seen that many more people are opting for, and I don't think they're opting for it, they're being told that they need it, spinal surgery, such like spinal fusions, things like that, when in actuality, we've seen very little to no benefit from spinal surgeries compared to people who just get conservative treatment first. So also realize that if the surgeon owns the MRI machine, so these surgical suites where it's like, hey, go right down the hall and get our MRI. Well, if the surgeon owns the MRI and it's sort of in-house, these people are, on top of that, 34% more likely to have spine surgery than if the surgeon doesn't own it. So get that orthopedic physicians and neurosurgeons love them, but at the same time, the evidence is moving against them. The orthopedics and neurosurgeons, spinal surgery is one of the highest reimbursement, and you get paid the most to do these surgeries, and it just so happens that doesn't matter how bad the back looks, it's just that all of a sudden we're seeing that more and more of these things are done. So wink, wink. I can't really wink, but something real fishy going on there. So for anybody who's been recommended to have spine surgery, injections, whatever, imaging, these images are being done in the presence of very little chance that anything actually is seriously wrong. So we found there's little to no correlation between what is found on spine images and what people actually feel. In fact, we know that people who get images are more likely, like I just said, to have spine surgery, receive unnecessary treatment, be addicted to pain pills, and just suffer with chronic pain. So with that being said, the outcomes are not better, and get that the biggest predictor of whether or not somebody has spine surgery is where they live. So as this area grows, as we see more surgical suites pop up, I won't name them, but you know who they are, we're going to see an increase in the utilization of surgery. But the problem is we're using surgery more and more, but we have more and more problems. And back pain is the #1 cause of disability in the world, despite having all these wonderful implants and surgeries and things like that. And people are just sort of brainwashed by so-called experts believing or being told that they need them, when in actuality, it's all just a big racket. So we know that about 1 to 2%, so 1 to 2 out of 100 people who have back problems actually have something serious going on. So a cancer, something else, infections, things like that, something big and ugly that might need further intervention like an image. And one of the big indications for surgery is really just that the nerve is dying. So it's not just some feeling of numbness tingling down the leg, it's that the nerve, the health of the nerve, losing strength, losing feeling, and it's getting worse and worse and worse and not better with conservative treatment. But instead, that's only 1 to 2%. Instead, 98% of people that are going in are getting images. So it just doesn't make sense. Again, based off those stats, 1 to 2% of people are likely the only amount of people that need spine surgery. And I don't know what the current stats are, but it's much, much higher and on the rise every day as these surgical suites move into the area. So be aware of that when you're meeting with a spine surgeon, that is their bias. That is what they do, and that is what they get paid for. So Dr. Charlie Johnson, pain relief specialist, natural pain relief specialist. Call 484-552-3767. Thank you.